thanks so much to Mainliners, and I also will echo the thanks to Ian for his great job coordinating everything. So really, what I wanted to do today is just kind of give you a little bit of an overview of the project that I've been working on for the last 5 years. I'm a social worker, and I've been working on a research study for about 5 years, first as an interviewer and then now as a project director. So I wanted to give you a sense, an overview of the work that we're doing, the research that we're doing, but also talk a bit about the way that we do it. And the reason that I'm focusing specifically on the way that we do the research, I will talk a little bit about our data and the results and what we found out. But in particular, I wanted to talk about the way that we go about, running our study and kinds of the services that we've integrated into it. Because I think that one of the things that I've found is that when talking about hepatitis C and talking about prevention and transmission and doing this research and looking at incidence and seeing who's got it and what the risk factors are, one of the things that isn't talked about enough is the impact of social marginalization and stigma and that's associated with drug use. And I think that until we also engage in that conversation, we're missing a key point, because from what we found, a lot of people know how hepatitis C is transmitted, particularly the injection drug users that we're working with. They may know, blood-to-blood contact, that it's a bloodborne infection, but there's certain pieces that are missing, and that's about breaking down the social stigma associated with drug use to be able to engage in conversations. So that's kind of why I'm going to focus a bit on how we go about doing the research. To give you a little bit of context, I'm from New York City, and the research that we're doing is in New York. Research has suggested that in New York, 64 to 75% of injection drug users are going to test positive for hepatitis C antibodies within the first 6 to 7 years of initiating injection. Holly spoke about that a little bit this morning, similar research. So as we know, HCV transmission appears to continue at unacceptably high rates. This is not a surprise to any of us, I don't think. We have seen some decreases, but again, something is still not working. And what we found in looking, before we applied for our research, was we looked at all the different kinds of hepatitis C prevention messages that are out there, and we found that there were a lot of really confusing messages, tons of messages, different messages, anything from, just sharing, don't share syringes, to don't use drugs, to, just a whole number of messages that could be a bit confusing. And so we wanted to do research that would simplify those messages down, look at where the risk really is. So we applied and got funding from our federal government, the National Institutes of Health, to do a research looking specifically at acute hepatitis C. So what we're doing is we're investigating the early stages of hepatitis C among drug injectors aged 18 to 35 in New York City. And we also are looking at infection among people who have just initiated injection within the last 5 years. So to give you a little bit of context, we do our research out of the Lower East Side, in New York City's Lower East Side. There's some pictures here that you can see of Tompkins Square Park. New York City's Lower East Side has long been sort of an area for, it's attracted the marginalized populations to some extent, the freaks, the junkies, the queers, a lot of activists. There's been a long history of squatting. So there is this central community in New York's Lower East Side, which is kind of why we decided to do our research there. There is a large injection drug user population. There's a lot of squatters and travelers that will come through, and that's who we're working with primarily. We have a large population of transient folks that come through every summer, traveling by to stop by in New York City, and so maybe they're doing their injection drug use when they come to New York, but then moving on and not necessarily engaging in the same behaviors elsewhere. But we try and tap that population when they come in. So you'll see some pictures from the park. It's got an overview. It's got a picture of someone in the corner who's actually overdosed. You can see that there's needle wrappers in the park and Narcan needles. So responding to overdose. Injection is happening in the park, outside, high-risk area, high-risk behaviors. Don't try, shoot dope till you die. Again, there's a big population that we're working with of young IDUs. The research that we're doing, just to give you a sense of what the actual research protocol is, initially we do recruitment through a number of different avenues. Primarily, though, it's word of mouth, and we also do RDS, so respondent-driven sampling, where people get coupons and give them people that they know to bring them back in. Again, our criteria are for it's injectors 18 to 35 or have just initiated injection within the last 5 years. What the actual process looks like: people screen, they come into our center, they do a brief 5-minute screening to see if they're eligible. If they're eligible, then we do a 2-hour risk behavior interview with them. We do testing for hepatitis C and HIV. For people who come back, and then we provide incentives. People come back after 2 weeks and get their results. For people who test negative to hepatitis C, we will ask them to enroll in a cohort study where we'll then follow them over the long term, testing them for hepatitis C using a very sensitive viral test. So at the initial testing visit, we do antibody testing as well as viral testing for hepatitis C using a very sensitive measure. And then when people come back for the cohort study, if they are negative, whether it's just viral negative or antibody negative, antibody positive and viral negative, so they've been exposed at some point but have cleared the virus, we'll invite them to participate in a cohort study. So by doing this, we have data on people within a very small window of period. Sorry, let me collect myself. By doing this, we're following people, and we have the opportunity to potentially find out the precise moment when someone could become infected with hepatitis C. So we follow people who are negative from the beginning. We ask them to come in every week or 2 weeks, depending on their status, and we're going to repeatedly test them for hepatitis C. So if someone transitions, we're going to be able to identify that infection as soon as it occurs, and then be able to offer treatment if they want it. And then in the meantime, for people who remain negative, we're constantly engaging in a process of counseling, providing supportive services, safer injection, education, things like that on an ongoing basis at every visit that we see people.